Hello, Bay Area. You are listening to Radio Mirchi 1310 AM. This is RJ Mirchita. And as promised, we are today a little bit early, but we have a doctor who is our special guest today from Texas, Dallas. And as you guys know, okay, it's time difference, right? To, save all of our time and make it convenient. We have Dr. Vadher and Dr. Prakash today, who are with us, and we will be discussing. Today's agenda is about, hey, how do I detect COVID? Hey, how do I prevent COVID? Are there any medication? What should I do, or which medicine should I take if I get COVID? बराबर है ना એટલે there are these very key aspects and key things that we need to discuss. And to introduce Dr. Bharat Vadher, if you don't know, then he is located, he is right now talking to us live from Texas, Dallas, in United States. And Dr. Prakash Modha is right now talking to us from Rajkot, Gujarat, India. And Dr. Vadher is currently working as independent anesthesia provider in Texas, Dallas. I'd like to introduce Dr. Bharat Vadher and give a brief introduction. So, Dr. Vadher graduated from MP Shah Medical College, Gujarat in 1978. He completed his residency in anesthesiology from Lokmanya Tilak Medical College, Bombay, India. He moved to USA in 1988, completed his anesthesiology residency from New York Medical College, New York City in 1992. He completed his fellowship in cardiothoracic anesthesia from Albert Einstein Medical Center, Philadelphia, Pennsylvania in 1994. So a brief introduction, and we will discuss more. Okay, bhai, what does an anesthesiologist do, or an anesthesia expert does, and what is cardiothoracic anesthesia expert, right? I will invite Dr. Prakash Modha to share with our listeners some statistics, as usual, on COVID worldwide, India, and Gujarat. Over to you, Dr. Prakash.
Yeah, good morning, listener. I'll share the statistics for today's. In USA, the fresh new cases was 46,129 and the death was 743. In India, it is rising up. It's 4,12,618 and death is 3,982. In Brazil, it is 75,652 new cases and death is 2,791. And Gujarat, now if you consider the statistic, total new cases are 12,545 and death is 123. We go to city-wise, Ahmedabad, now it is decreasing trend. Yesterday it was 4,000 and plus. Now it is 3,957. Surat also cases are decreasing. 1,427. Baroda 1,018. Rajkot 729. Jamnagar also 729. Bhavnagar it has come down drastically 322. And Junagadh 445 cases. So these are the statistics from Gujarat, and nowadays we are seeing little downward trends because our COVID OPD had reduced and line of ambulance outside the civil hospital Rajkot has abolished totally. So cases has reduced a lot in Gujarat, and hopefully it should continue. Then we can achieve something better results for the COVID, and we are happy that it is a downward trend. Yes, over to Mirchita.
Thank you, Dr. Modha. It's good news for all of us. And today's statistics were really in good shape compared to what we started on last Friday. It was,
Yeah.
if you guys don't know, then let me tell you, we started our first COVID awareness show last Friday night. Like in India, it was Saturday morning, and you can see that within just 1 week or just 5 days. Today is our sixth day of COVID awareness show, and you can see so much improvement already. So, with further ado, I would request Dr. Bharat Vadher to first of all tell us what is this branch of anesthesiologist, or what do you do, or what is this whole field? Right, it's completely new. We have heard about surgeons, we have heard about neurosurgeons, but this is something which is like playing a key role, and not many people know about it, right? So let me invite to
Yeah,
you and first explain our listeners what is this.
Before
well,
Bharat starts, I will tell that anesthesiologists are the men behind the curtain. મીન્સ પડદા પાછળના કસબીઓ, પડદા પાછળના કલાકારો કે જે સર્જનને મોટો બનાવે છે. તો રિયલી ગુડ એનેસ્થેટિસ્ટ can give help surgeon to give a good result. Okay, Bharat, please carry on.
Excellent.
in a one sense, jack of all and master of none, in the sense that anesthesia is a branch which is very unknown literally during your medical school. We barely get any exposure to anesthesia. Unfortunately, that really causes a little problem when you get out of the medical school and you select anesthesia as a branch to practice in your life. Anesthesia mainly deals with surgery and putting patient to sleep or comforting them during any surgical procedure or any procedure which requires calmness, sedation, and stillness so that the surgeon or whoever is the operating person can perform their task without being disturbed by movement or any other things that can happen because there are times when the surgery is on, somebody may drop their blood pressure, somebody may not be able to have their oxygenation well, and surgeons are not doesn't have a time to take care of them. And truly speaking, they don't have enough knowledge how to handle those things. So during 5 years of training, you learn lots of basic things about physics, physiology, pharmacy, and then clinical side of it, and an application of all that you have learned during your medical school, and you strengthen it during your 4 or 5 years training so that you are literally anesthesiologists are as good as a critical care expert or intensivist because they have to deal with a similar situation in the operating room when there is patient is between alive and dead. And that is where we continue to take care of them and maintain their vital functions and help the surgeon achieve their final goal.
Excellent. A lot of us don't even realize, recognize, and don't even know. I'm so grateful today to Dr. Moda and Dr. Vadher that you are really sharing this knowledge with common men, common people who don't have medical knowledge at all. So this is great. And moving on to our next question: what causes severe coronavirus disease?
Well, coronavirus is a kind of a virus which is usually commonly doesn't go to the extent which we see it now. It usually produces mild symptoms. And coronavirus is existing for so many years, hundreds and hundreds of years. But the disease that coronavirus has produced until now was mild. Basically mild cough, mild temperature. These particular two viruses, SARS and corona, are the one which are producing a severe disease which can affect not only pulmonary system or not only lung or breathing. It can affect your heart, it can affect your kidney, it can affect your brain. So, and it is produced by coronavirus. Now, there are two kind of viruses. Either viruses are basically a genetic material coated by the protein. Now, you might have heard, spike protein. That spike protein is a protein under which the genetic material, which coronavirus is RNA kind of a virus. There are DNA kind of virus, but coronavirus is RNA kind. So this virus basically gets into the air, goes into the your mouth, goes into your pharynx, and from pharynx it travels down to your lung. Once it travels down to your lung, it is always goes into the cell because virus needs to go inside the cell so that it can multiply. When it starts multiplying, it starts using the material the cell has, and eventually it will cause destruction of the entire cell. And once the entire cell is destructed, they start producing the symptoms because slowly but surely most of the lung tissues are getting destructed, and then once they get destructed, they releases substances which are very toxic to lungs, and then those substances start going into the general circulation and affect the whole entire body. And that is how you see the symptoms like multi-organ failure. So that the disease produced by coronavirus itself is called coronavirus disease, and it can range from mild to severe to death.
Thank you, Dr. Vadir. Um, so only one question I have here is in United States we have like either you are positive, COVID positive or negative. There are no mild, severe as such. Is that right?
I would say it is not correct. If you look at the statistics of the coronavirus disease,
Mm-hmm.
the 98%, literally 98% of people survives. 1.8 to 2.1% dies. Now, out of 98%, half of them are just very very mild symptomatic. That means they have a headache, they have a no they have headache, they have a scratchiness of the throat, they may have a fever, they might be feeling tired, they may have a headache, they may have a stomach pain, all those sorts of mild symptoms. Now those are the people who doesn't require anything. I had my nephew and their entire family was positive corona, was tested positive, and they stayed back home 15 days and everybody was fine. So it ranges from one end to another end, and it is very hard to predict even, except when it gets worse. There are something called factors that uh, reactive proteins and all those things that body creates because of the release of toxin. And when those toxins goes higher and higher, that decides which person is gonna be having a trouble and which patient will not have a trouble. So it ranges from one end to another end. The protein name is C-reactive protein. So when you measure the C-reactive protein during the entire stage of entire illnesses, and if you have a higher C-reactive protein, your chances are very very high that you might end up with a severe disease.
I see. Thank you, Dr. Vadir. Moving on to next question. Why is COVID 19 overwhelming to the entire health system at a global level?
First of all, these pandemics are always overwhelming because it is spread all over. There is no way to isolate in one area, so everybody is exposed. Now, when everybody is exposed, it puts a strain on both sides, on the people side as well as healthcare system side. People side is that because the infection is so widespread that almost large population get infected. when the large population get infected, you know, severity of the disease itself makes it very difficult for the health system to really take care of it. If you have seen what happened in New York in last March, I mean, I had a friend. She was a respiratory therapist, and she said, "Dr. Warren, I would not believe it." He said there were bodies after bodies piled up outside. We were not able to see. There was a time where they said we have to decide which patient needs a ventilator, which patient needs doesn't. So this is an overwhelming situation. That was in New York, but then when it spreads to everywhere on the world, that becomes overwhelming for the entire world, in
Hmm.
my opinion.
Right, right. It. I think in India also it was similar situation, right, Doctor
Yeah,
Modha,
yeah.
recently.
It is worst. In India also, actually, if you are above 75,
Mm-hmm.
then and the person who is at 30, 40s, so whom should we give ventilator? So we used to give to the younger one because younger one had a better life ahead. So this is the situation we were also facing, and particularly even in the admission also. If
Hmm.
you are younger, we give them admission earliest. If you are older, you wait till the place become vacant. We used to create a space for the younger one, but
Hmm.
elder one, because otherwise our resources are very
Limited.
very limited resources, and in limited resources you have to weigh the balance. Who needs more? A younger person, હજી નાનકડો જુવાન માણસ હોય એની જિંદગી લાંબી છે હજી અમારા જેવા હોય તો ઉડી જાય તો વાંધો નહીં એટલે that was the basic reason that we used to uh, uh, take consideration in deciding whom should we give the bed. So
Hmm.
this is still it is a similar situation.
Hmm.
We are, but it has reduced little. But still there is a
Yeah,
loss of patient.
in America is little different.
Hmm.
They go by statistics, and
Uh-huh.
statistic has proven that younger people have a greater immunity. They can fight the disease very well, and number of casualties or more severe morbidities were lesser in younger people as opposed to older people, because older people have multiple medical issues. Their immunity is not as great as the younger one, and this virus can be still fought back with a greater immunity. So here the approach is little different. That, if the patient is younger and patient doesn't have any comorbidities, most of the time those younger patients will get through this disease within a reasonable time period. But given the similar kind of a disease to an older person, they may not have enough to fight with. Their entire body system is has a limited resources, and this coronavirus will use that limited resources to get them to the end of his life. But that is how these people have taken approach here.
But
uh,
that
and,
is
and
similar here only, Bharat.
and two,
So
that is one of the reason why the why United States has preferred to immunize, first of all, healthcare people, and then older people. They have given a priority to the older people with multiple medical issues.
Mm-hmm.
And then after that has been exhausted, everything has been done, then they have asked the younger people with comorbidities or with diseases that can cause a problem to them, then they will be immunized. And then finally, the younger one without any medical issues, they have to be immunized last. And now they are coming up with a vaccine for children from
Kids.
12 to 18, which is going to start, I think, from this week or next week. And after that, in September, they are producing vaccine for the kids between 2 and 12 years old. So, that sets up a priority, which is more, which person can fight infection more. And truly speaking, globally, you see most of the time the deaths are beyond 50 years old, higher than,
Hmm.
or who have a medical morbidities. But that's the approach here.
I
Yeah,
just,
a
yeah.
similar approach we are also
Yeah.
having in India also, but
Mm-hmm.
still we have not decided about the children.
Hmm.
But now we are vaccinating old people above the 18 years of age, and
Yeah.
but because of the little shortage of the vaccine, uh, we are uh, segregating grade by grade by time after May, then after June, July, like that. We are dividing the population to get them vaccinated. So
And the
this is
other
the
part,
situation in India also.
yeah, and the other part, it is overwhelming in countries like India, maybe China. We will never get a true figure from China,
Yeah, yeah, yeah.
uh, because they will hide. The problem here, what I see and what I believe, is the population per square foot of a land. That makes it very difficult for them to put apart people that can decrease the chances of spreading coronaviruses, and then educating the people what is good for them. And if they follow the advice by CDC or WHO, they can even control what they have. Because, as I said, most of the younger people, most of the healthy people doesn't have to worry about this virus, literally.
I just got my second dose of Pfizer vaccine day before yesterday, and I'm doing fine. So I want to request all of you who is watching us live, please go register, take appointment for vaccine. It is not for bad; it is for good. So requesting, and doctors, you can also make that request and appeal to people to please take their vaccines.
Let me put it this way. You know what? There are a few ways to get immunity, and I will get to that.
Yeah.
One, one is basically active, and one is a passive way. The passive way to get to fight this disease and get the immunity is either by gamma monoclonal gamma globulin, or by plasma of a people who had been already infected with coronavirus, and for about 3 to 6 months, I think they have a high titer uh, to have antibodies which can fight with coronavirus. These are all passive. Now, active, which is the most important thing, is a vaccine. So,
Need.
if you get a vaccine, your own immune system is prepared to produce antibody, and that is the best system you can ever have, because the antibody treatment that you get will eventually be used. You have only certain amount of antibodies you can transfuse, and after that antibody is transfused, you don't have anything to fight with. But when you have a vaccine, your own body continue to make antibodies until there is no viruses in your system. So I highly recommend that, no matter what, I don't think anybody has died just because of vaccine. I don't think so. And I have even yet to hear that vaccine caused somebody to die. It might be some associated disease that person has, may resulted into something drastically bad. So I would say, if you want to protect yourself, if you want to protect your family, and if you want to protect your city, and if you want to protect your nation, the only way to protect, if you get an opportunity to get a
Vaccine,
vaccine,
vaccine, vaccine.
please do it. I
Bharat,
had my
we have
vaccine. I
seen.
had my vaccine in first week when it produced by Pfizer, on the first week, third day. way, I think it was in December.
Excellent. Dr.
And
Modha?
I had no issues with vaccine. I had two doses, nothing. First dose was just a piece of cake. There was no problem. Second dose, I had a little heaviness in the arm and little
Mm-hmm.
headache for one day, and it was gone.
In India, actually, we do have some. See, almost more than 50% people who take vaccine don't have any problem. But some of them, they do have headache, mild feverishness, body ache, and with the help of paracetamol, this become
Right.
all right in a day or two. So
Yeah.
here also we don't have any mortality with as far as the vaccine is concerned. But sometimes what happen, people having some morbidity, some heart problem, some blood pressure, diabetes, and they given a vaccine. So some mishap happened, but that is actually not the vaccine related mishap.
Yeah.
All
Yes,
right.
Bharat.
So,
Mirchita.
moving to the next question. So, the next question is, if I get COVID, what should I do?
Well, if you get COVID, now, as I said, there is a wide range of symptoms for COVID, ranging from just a mild body ache, headache, soreness of the throat, um, some smelling issues. In those kind of a mild cases, you isolate yourself for 10 to 14 days. Make
Mm-hmm.
sure that you stay by yourself in your own room, in a very ventilated room, because ventilation is a key again. If you have a closed room, you are accumulating that virus in a large quantity in that room. So you make sure that you have enough light, enough enough ventilation. You have a mask, and every time you do something, or if you step out of the room, you make sure that you don't touch anything. If you touch anything, you wipe it with any antibacterial or any kind of an alcohol solution, and you stay in your room for 10 days. Isolate yourself and distance yourself from people who are healthy. Basically, those who have symptoms and are feeling that they need an oxygen, for them, there are various ways. One, which has been recently under investigation, is, as I was saying, monoclonal antibodies. If you have heard, Mr. Trump was positive and he got two doses of monoclonal antibodies, and next day he was willing to come out of the hospital, and he did come out. Because what does the monoclonal antibody does? If you can catch the disease in right time, if you are positive and within 5 or 10 days, if you give these monoclonal antibodies, your disease is gone practically. It won't happen. Now, if you go from that stage to the third stage, where you have symptoms and you are feeling short of breath, you have difficulty breathing, and all these things, then the best thing is to go to approach an hospital. Now, I would not go to the hospital. I do not know what is the situation in India, but I would not go to the hospital without calling them. Say, hey, listen, you know what? This is my problem. What do I do? Can I come there? Or can you suggest me where to go? So this is the third kind of person. And once the patient is in hospital, it can range from mild to severe outcome, as we have all noticed.
I will add, Bharat. In India, what is the situation is that if patient has got symptoms of COVID, means headache, feverishness, body ache, dry cough, then they contact the doctor
Hmm.
on phone. They said, because we are running a COVID OPD also,
Mm-hmm.
but our OPD rush is such almost 300 OPDs a day.
Hmm.
So what we do, we have created home care system, and we send our nursing staff to the at the home of the patient, and he will find out what is what exactly. That is it COVID symptoms. Sometimes you do have another symptoms also. So then our medical officer goes and he will advise investigations, and our team goes and do the antigen test at home, and once they come positive, then they will isolate them and treat them. If it is mild to moderate, we'll treat them home, at the home only. And then uh, once patients have a difficulty, whether he requires oxygen, up to 2 liters of oxygen at home is okay. But if we require more than 2 liters, then we advise them to hospitalize. Sometimes they require non-invasive ventilators like BiPAP, CPAP, and that is why we advise them to admit. But what is the latest situation?
Hmm.
Nowadays, social groups has come up, and they provide oxygen, bed with oxygen, with a free food, almost 100 bedded hospital where you can go admit and take treatment free of charge. There is no charge for that. But if you require higher treatment, suppose BiPAP, with a force you want to you introduce oxygen into the respiratory system, that is called BiPAP or positive pressure ventilation. In such cases, they require a higher hospital where these facilities are available. And that is where we are having struggling actually at the moment, that lots of ventilator we are using. Almost in our 100 bedded hospital, we have a 40 invasive and non-invasive ventilators.
Oh, wow.
40. So
Uh,
it is difficult task, but we are coping up. And as I said, that cases are regressing. I hope
Mm-hmm.
that this also need of a ventilator also will regress in future. Let us hope so.
there is another thing that I have come across and sometimes can help, and that is the positioning of the patient. If patient is suffering from COVID-related lung disease, in a situation like that, you may be able to take him off from some of the help if you put him in a prone position, because prone
Hmm.
position increases
Yes.
the ventilation and ventilation, as well as the perfusion of the blood to all the part of the lung are more equal when they are in prone position. So they recommend that if a patient is, uncomfortable, you give him, even they are awake, 4, 8, 10, 12, 15 hours in a prone position, they may cut down their symptoms. They may cut down the
Hmm.
oxygen requirement also. But that is what
Excellent.
they have done here.
All right. So, doctors, keeping time in mind and moving to the next question, which is
Yeah.
how should I prevent getting COVID 19?
Well, the best way to prevent COVID-19 is to, first of all, educate yourself how COVID is spread. And then you do what is necessary not to spread. Thereby, COVID, once you sneeze, once you cough, COVID is everywhere. And
Mm-hmm.
it has been proven that it can travel even more than 6 foot. So once you know the virus is out there and you can't see the virus, the best thing is to do is to follow the guidelines locally created by medical people, wearing a mask, how to wear a mask, how to wear a distance, how to keep a distance, and then isolate yourself. Wash your hand when you go out, wash your hand when you come out, wash your hand every now and then frequently. Do not go out in a crowded environment. If you have to go out and get a grocery or something, select the hours which is not crowded, where people are less. You can go early in the morning. If whenever they open, people are less. When you can go early, so that way you are trying to avoid a contact with coronaviruses. So if you can educate yourself how the virus spread and prevent yourself from getting closer to the virus, that is the only way I believe you can prevent it. Because once you get it, you get the symptoms no matter
Yeah,
what. It may be mild, it may be severe.
right. So, thank you, doctor. Moving on to our next question, which is it safe to go to hospital if I get any other disease apart from COVID-19 in the pandemic?
Yes, and yes and no. Yes, because if you can protect yourself, if you follow the advices by keeping distance, wearing the mask, not touching anything when there is a pandemic on, then it is safe because in the hospital, most of the hospital follow very strict guidelines. They clean everything every day, maybe every 6 hours, maybe every 12 hours. So I think hospital is safe if you can do and follow the advice by any health organization to prevent COVID, you can do the same thing when you go to the hospital. So I don't see why you cannot go into the hospital.
All right. Thank you, doctor. So, guys, it is safe to go to the hospital. Don't get scared. And the next question is also related, which is Dr. Modha, any comments?
Yeah, actually, we have a COVID and non-COVID hospitals only. So it is both hospitals are separated.
Separate.
So there is no need of fear. You go to non-COVID hospital, and even if you had COVID and you require surgery, the COVID hospital has got all facilities to operate you in the same hospital. So this is the things which we are doing here in India.
Excellent, Dr. Modha. So next question was also, I think, related, which is if I need surgery, do you want me to proceed with it or postpone it, or how do I make that decision?
Well, there are two thoughts about it. One, here, if you have an elective surgery, and if you can wait until COVID goes over to a reasonable level, you can wait. But if you have a surgery which is urgent or emergency, there's there's no need to wait because it is you who are going to spread COVID to others. Remember this. If you have a COVID and if you need a surgery, it is you are trying to infect others. So the other people will obviously take care of themselves. But if you need a surgery and if your life is going to depend on that surgery, there is no need to wait. You have to proceed.
All right. Moving on to the next question, which is what are current and most basic remedies for COVID-19?
Well, the way the things has been is that viruses does does its work by producing disease. Now, there are what we call symptomatic therapy, in the sense, if you have a headache, take Tylenol or paracetamol, I guess there. If you have any GI trouble, take the medicine for your GI upset. So these are where all related to symptoms that a COVID produce. On itself, how COVID can be attacked. The virus itself can be attacked. Now, there are only a couple of modes, a couple of things you can do. Virus, the way the disease work is one, virus replication. That means virus continuously divides and spread. So, if you are in that stage, and if you get the virus in that particular stage within few days of your disease, you can try antiviral therapy. Also, as I said, I do not know whether that is available in India, but in the United States, they are they have the monoclonal antibodies, which also neutralizes the virus. So these are the two remedies that they have. Now, once the COVID establishes a full picture, in the sense COVID does by replication of the virus and by disturbing the immune system, that means the immune system is so disturbed that all these toxins that is released by body now spread And at that point in time, antiviral will probably not work. At that time, you have to produce something kind like what we call interglobulin, or some kind leuco, interleukin antibodies, where
Mm-hmm.
interleukin is secreted, which causes destruction of the whole body systems. So you produce an antibody, you give them antibody. Also, you suppress the inflammatory reaction by giving steroid. But that is in a very, very third or fourth stage or last stage. So this is how the remedy is being classified, preventing at the viral replication stage and then taking care of whatever damage because of the virus and toxin has then try to take care of the toxins and prevent that toxin from spreading too much out. But that's the current therapy that is existing.
I will add, Bharat, monoclonal antibody is available in India and it
Mm-hmm.
is from Eli Lilly company and that
Hmm.
Right,
costs almost 45,000 for a single dose.
Oh
right.
my God. Wow.
And there is a helpline on monoclonal antibody. There is a
Mm-hmm.
1-800 number. I don't know. I had somewhere else. I had written it. And there
Mm-hmm.
is also a helpline for a patient on Lily's website. If I can find it quickly, I will. It's called COVID Hotline Lily, 1-855-545-5921, and for health person is lilyantibody.com. So
Yeah,
if any patient wants any kind of information, it is on this lilyantibody.com.
yeah.
They can go in and find it.
Okay, very
Okay.
good.
Thank you for the great information. Dr. Modha, do we have time to take other questions or?
Bharat, now we'll have a last final question only.
Yeah.
And
Uh,
I think that is how can oxygen be avoided in patient? Any machines or etc. is available
There is something
at
called
home?
oxygen. There is something called oxygenated concentrator. That
Yeah,
machine, what it does is basically we use it in anesthesia in an outpatient surgery or in an office base. What it does is uh, the air, is had 21% oxygen, 90, what is it, 80, what is remaining is nitrogen.
yeah.
So what this machine does is it takes the whole air and take out nitrogen. So it concentrates the oxygen, and you may get the air coming out may have about 80% oxygen or 85% oxygen. So you get a concentration, and you use that. You can convert the air into higher concentration of oxygen.
Very good, very good. That is also available in India
India?
also.
Uh-huh.
Oxygen concentrators are available,
There is
and
one thing
we
I
are
wanted
getting
to.
help.
There is one thing I wanted to say that people have disregarded one of the most important thing. Are you still there?
Yes, yes,
Yeah,
Uh,
yeah.
yes.
yes. The people have disregarded the most important thing in this whole fight against COVID is developing and keeping immunity intact. It is extremely important to have people keep themselves without stress, thereby, have a good protein diet, good sleep, good exercise, continue to be in touch through phone or something with the people who are affected, with who are not affected. Do something that you like to do on a routine basis instead of going out, do it at home. These are the factors which are very vital in not stressing yourself out, because once you stress yourself out, it affects your immunity. Another thing, excessive use of alcohol, tobacco, and all those things, those are bringing down your immunity. And if you can do to preserve and stay out of your stress and preserve your immunity or strengthen the immunity, you have a higher chances of fighting out this disease.
Very nice, very
Excellent.
good advice, Bharat. And I think with this thing we can fight COVID in an effective way, and we
Yeah,
can
it is.
help the
That's true.
all viewers that have a good diet, do yoga, do exercise, and good food will beat the COVID.
Yeah, we are all into
Excellent.
this together.
Yeah,
Excellent, excellent, doctors. And that's why I want to again let you guys know that tomorrow we will have one more doctor with some new questions, new advice, new stuff, which we all learn every day, right?
yeah,
Yes, Dr. Moda.
Yes.
yeah. Tomorrow we are getting Dr. Tejas Karamta,
Uh huh.
who is also an intensivist, and he will speak about the ECMO machine, which is one of the latest advice uh, for the COVID management and the high-end treatment for the COVID management, which is being done in Rajkot. And
Mm-hmm.
he will elaborate the treatment by the ECMO machine. Who need ECMO machine? What are the factors? What are the costs? That he will tell us in detail, and what are the outcomes. Bharat, we have two ECMO machine in our hospitals, and probably one is our hospital and another is another hospital. So only two hospital has got ECMO machine in
I tell you,
Saurashtra.
yeah, I tell you, I was telling people that yes, ventilators are more important, but they may not be a lifesaver. The only thing that can save your life is ECMO, because
Hmm.
Yeah,
practically your whole body can get destroyed, and you still can survive because of ECMO until your
yeah,
body gets repaired by itself. So ventilator may not be the last answer, but you can't produce thousands of ECMOs.
yeah. That's the problem. And the
Yeah.
second thing which will come into this program is that more and more people who affected with the COVID and they get lung fibrosis,
Hmm.
uh, and they are being transferred to Chennai for lung transplant,
Mm-hmm.
and how they transfer by air ambulance, and that will another doctor will tell us about the air ambulance transfer and lung transplant. So this will be
You are
our
doing
future
excellent
program.
job.
Yeah, that is what we are doing. And I'll tell you that is Hardik Vekaria, and he'll be talking to us on 11th of May about all these things.
Well,
Yes,
So, but we are taking this interesting program. So, whenever you please join us, guide
yes,
us, and tell us anything further can be done.
it
yes.
is my pleasure. I'm thankful to you for allowing me to be here. Although I would have been by sleep now by now.
Yeah,
Thank you so much, Dr. Bharat Vadher and Dr. Modha. I know it's very late for you. It's pretty much like I think 10:30 there, right? So it's very
Yeah,
late in
yeah.
Dallas.
thank
But
you, Bharat. Thank you
thank
very
you
much.
so much, and we expect
Thank
you
you.
to
And
come back again in the
please
show.
be with us
Yes.
always and help us to fight COVID in India.
Sure, I will. Thank you for having me.
Thank you so much.
You
Thank
guys
you.
have a
Thank you, doctor.
wonderful day. Thank you.
Okay.
Bye.